So this is a pretty interesting lady, and she kept getting these unusual discharge or growths coming out of her nose. She actually thought she had parasites growing out of her nose. Primary care doctor actually suggested that she see a psychiatrist. If you've never had this type of problem before, all of a sudden you're getting these large collections coming out of your nose, and no one knows what's up. It could be really disabling. They got a CAT scan on her. In reality, she likely has a large fungus collected in her cheek sinus. Now, she has no history of sinus disease, so obviously that was pretty concerning for her. But with fungus in the sinuses, the treatment's just get it out. You have to remove it. There are some things that can put patients at risk for this, like if their immune system is a little suppressed. Conditions like diabetes, for example, can cause fungus to form anywhere, basically. A tumor could look like this too, so the same surgery that I do to remove a fungus is the same surgery I do to remove a tumor, just through the nose, just entirely through the nostril. No cuts or anything on the face. We can do everything minimally invasive and endoscopic. I think it really helps with recovery because this patient will likely just go home right after the procedure. Right now I'm just decongesting her nose whenever we start surgery, just to reduce blood loss. We use special sponges in the nose that just help reduce bleeding. This was actually a procedure in the past that was only done through open incisions, but now we can do it pretty safely and easily endoscopically through the nose. Our instruments have gotten a lot better. This is our drill right here. It's made just for the nose. It extends longer and it kind of extends at an angle. It rotates, it irrigates. Yeah, before we had the drills, it was hard to do a lot of this work. All right, so now we're just getting some more exposure because we see that the fungus is extending pretty deep into her sinus. So you can see more of this fungus hidden here. See how much space you can get. I just want to take a culture. This is for the research. But we have asked permission for her to actually sample some of her sinus tissue. We can analyze it afterwards and use that for our future research protocols. This is the specimen, and we can see our research team over there.
So our study is looking at the microbiome in the nose, so like the different bacteria and funguses that live in there. And so that just lets us look at how much of different types of things are living in there. And so the idea is that once we process that data, that'll help us determine like what kind of antibiotics to give or antifungals, and it makes it better to treat patients. So it really lets us figure out exactly what's going on. We only need a little bit, but that little sample will have tons of bacteria and fungus on it.
So this is a specialized camera I'm using. It allows me to look into all the nooks and crannies of the sinuses. So now I'm just getting out all the bits of fungus in here just to make sure it's all cleared out. Similar way to how I would do a tumor. Tumors usually have a point where they're attached. So you want to make sure that you go to the roots of the tumor, kind of like the roots of the plant. Remove it entirely and get a margin in the area where the tumor is arising. So that's created the opening, checking with an angled telescope to look in all the nooks and crannies to make sure that I've cleared everything out. Can I get the drill? And now I can see the entire sinus. There's no more of the fungus in there. I can just dry everything up. This is a surgery of like an open wound, so we do have to make sure that it's very dry and call it a day. Easy as that, yeah. She'll likely go home about 2 hours after the procedure. So the important part is that we have a large team of neurosurgeons and rhinologists such as myself. You'll meet the whole team. Every tumor is a little bit different on how we approach it, but we really think about the whole patient and make sure that we guide the proper care. So because we did this entirely through the nose, she'll have no incisions, she'll have no swelling of her face. She actually won't even look like she had surgery. She'll feel a little congested on that right side, and that's entirely normal. And then within about 2 hours or so, she'll be ready to go home. In this case, we finished in 38 minutes. So with these types of approaches, the outcomes are definitely much better.